Assalamu alaikum. We are going to revise NAPLEX CPR. So our first series about CVS, which I have divided into episodes. So it is approx 5 episodes we will cover. And today is our first episode, which is about hypertension. So let's get started. Assalamu alaikum. Welcome back to my YouTube channel. So let's start from where we left on our last lecture. So what is a direct vasodilator? The vasodilators, they are talking about the arterioles in our body, all over the body. It's about all over the body arterioles, and we are talking about their dilation. So there are two drugs we are talking about, the hydralazine and minoxidil. So currently we are practicing hydralazine, but minoxidil are not practicing. The reason behind is that it is for using hair growth. Hydralazine brand available is Zafa with hydralazine HCl, company name Zafa, Minoxidil, Pakistani Brooks company. Okay. The side effect of hydralazine is headache, hypertension, palpitation, reflex tachycardia. Okay, so warning: if you have mitral valve heart disease or coronary artery disease, CAD, you won't use this drug, and it can cause dial lupus. Dial lupus are the condition where some of the drugs, like we are mentioned hydralazine and cafe, some of the drugs which activate our immune system, and in result of this, there is small patches on our skin like red, like erythema. So this type of condition will develop due to some of the drugs, the which is cafe hydralazine also included in those drugs. Let's talk about minoxidil, fluid retention, tachycardia, and hair growth, which is very important side effect and which is adverse effect, but it's huge adverse effect. It can cause pericardial effusion. Pericardia is the membrane around your heart. So it can cause effusion of it, and it can also cause angina. If you have pheochromocytoma, it is a condition in which you guys have adrenal gland, and on these adrenal glands there is a cell called chromatin cells. Those cells are responsible for the secretion and for the preparation of the hormones. So this, if you have tumor of pheochromocytoma, so you don't need, you can't use this drug. So there's a minoxidil is an OTC drug for the hair growth, and instead of minoxidil you use beta blocker and plus loop diuretic for hypertension cases. Another mechanism is alpha 1 blocker. GNC guideline inhibit this usage, so we are not using, currently we are not practicing using alpha 1 blocker. So mostly we are, if the man have a benign prostate hyperplasia condition, so to use for those type of condition like toxosin, prazosin, tharozosin. Toxosin, which is available brand is Cardura, Pfizer, prazosin Minipress, and tharozosin Hytrin brand is available, which the company is Abbott. Adverse effect: dizziness, fatigue, headache, edema. It can lead to orthostatic hypertension. It's a type of hypertension in which you, like, it's a kind of condition of fainting. Syncope, and it also lead to syncope. Caution with the PDE5 priapism. Priapism is a condition in which erectile dysfunction occur, or this erectile dysfunction is due to the phosphodiesterase inhibitor. If you are using phosphodiesterase inhibitor and it can lead to priapism, you should avoid this drug, this terazosin. There is no contraindication. CYP3A4 and liver impairment. Cadura XL is a ghost tablet. We have talked about what is ghost tablet. So I want to repeat the grapefruits are inhibitors of CYP3A4 enzyme catalyst. So those drugs which require CYP3A4 for their metabolism, you should avoid grapefruits because it's inhibit. When they inhibit this catalyst CYP3A4, then the drug metabolism is stopped in the body, and which lead to storage of the drug in your inside the body, and which can lead to the drug's toxicity. So you should avoid grapefruits. And I think for a general public, should advise they should avoid grapefruits if they are taking any drug for a long time period. And the best thing, if you have to if you can remember the drugs which are acting, which have metabolism through 3 CYP3A4, and the most drugs have metabolism through these catalase or these let's talk about angiotensin converting enzyme inhibitors. uh, these inhibitors block conversion of angiotensin 1 into angiotensin 2. So by this they decrease vasoconstriction, aldosterone level, and also improve kidney protective mechanism, enhance. So here are the drugs: benzapril, which is available with brand name Latensin, Enalpril, Vestec, Epand, powder form available, Lisinopril, Zestril, it is famous brand, Cunapril, Acupril, Ramipril, brand Altase, Captopril is Capotens, Enalpril, Vasotec IV, Maxipril, Perindopril is Sion, Trandalapril, Mavic. Okay, so here are the following drugs. ADRs: angioedema. It can cause angioedema. Okay, especially in black people. Hyperkalemia, hypotension, renal impairment, dizziness, headache, rash, cough. Warning: in pregnancy you are not using these drugs, because I have mentioned earlier those drugs which can be used in pregnancy. Contraindication: history of angioedema. If you have history of angioedema, you are not using these though. So it is very cautionable, because जितने भी हार्ट के पेशेंट्स होते हैं तो मोस्ट पेशेंट को एंजियोएडिमा होता है. सो इस चीज़ को आपने देख लेना है. यूज़ ऑफ नेप्रेसिलिन इन लास्ट 36 आवर्स. अगर आपने वेलसर्टन और सेक्यूरिल यूज़ की है, कुछ मतलब आवर्स देखने आपने 36 आवर यानी 2 दिन, तकरीबन 2 से 1.5 दिन के अंदर अंदर, तो फिर आपने इनको अवॉइड करना है. यानी आपने सेक्यूब्रिटिल और वेलसर्टन की थेरेपी से 1.5 दिन बाद आपने इस ड्रग्स को यूज़ करना, 1.5. नोट्स: क्यूरी कैन बी डोज्ड BD इफ नीडेड. ओके, अगर BD डोज देनी है, वैसे तो okay, ACE inhibitor prevent cardiac remodeling in patient with, this is called ACE inhibitor. So they prevent cardiac remodeling in patient with heart failure. अगर heart failure का patient है तो उसको cardiac remodeling जो हो रही होती है उसको prevent करते हैं. Avoid potassium ion आपने avoid करने हैं, because it can lead to hyperkalemia. So you need to avoid potassium ion and lithium toxicity. Okay, now let's move angiotensin receptor blocker. So they are block the receptor on which angiotensin bind. Angiotensin receptor blocker block angiotensin 2 binding to angiotensin receptor 1, prevent vasoconstriction of the kidney, heart protective like ACE inhibitor. So both are heart protective. Ebercertan, these families certain. Losartan, okay, ebercertan is Evapro, losartan is Ozar, olmesartan is Benicar, valsartan is Diovan, it is very famous brand. Condacertan is Atacon, azilsartan is Idarbi, aprocertan is Tivitin. So the same as ACE inhibitor, same adverse effect, less cough, angioedema. Okay, and no without a washout period with naproxen. Same warning, not recommended in pregnancy. Okay, so हिस्ट्री ऑफ एंजियोडेमा डू नॉट यूज़ विथ एंट्रेस्टो, यानी सेक्यूब्रिल के साथ आपने यूज़ नहीं करनी. ओके, ऑल्मी सर्टान स्प्रू लाइक इंटेरोपैथी, सीवियर डायरिया, वेट लॉस मंथ टू ईयर्स आफ्टर इनिशिएशन के बाद आपको वेट लॉस हो सकता है, तो इस तरह की ड्रग आपने यूज़ नहीं करनी. पेशेंट इज सो वीक. As a certain, keep in original container to protect from light and moisture. So both drugs you need to remember this. Avoid potassium ion and it can cause lithium toxicity. Let's move on. Beta 1 selective blockers. So these are beta blockers, but we are talking about first beta 1 selective. So these drugs decrease heart rate and contractility. Okay, so here are the okay, you can use mnemonic for this drug. It's amoeba, AMEBBA. So the drugs are A's butalol, available Sectrol, atenolol, tenormin, betazolol, bisprolol, zibeta, ismolol, bravi, block, metoprolol or titrate, low pressure, and metanolol succinate, available from toprol XL. So adverse effect: heart rate decrease, hypertension, fatigue, dizziness, depression, libido, and impotency. So these drugs do not मतलब आपको अब्रप्टली जो है वो नहीं करना, टैपर्ड करके हम इसको जो है वो फिनिश करते हैं, रोकते हैं. 1 to 2 weeks to avoid tachycardia ना हो. They can cause, beta blockers can cause tachycardia, so you need to taper the dose. So contraindication: patient who is bradycardia, AV block, arterioventricular block, sick sinus syndrome. We have already studied, so some patients also avoid the another class who have sick sinus syndromes and AV block. Ismolol do not use in pulmonary hypertension. You are, remember this, ismolol you are not using in pulmonary hypertension. Notes: mask of hypoglycemia. It can mask hypoglycemia and hypothyroidism. Use caution with broncho problem. If the patient have lungs issues, I'm not using it, or maybe you can take precaution. Take metoprolol because of, everybody knows that the sympathetic beta 1 and beta 2 because of selectivity of the receptor, and you already know the beta 1 and beta 2 receptors are also present in heart and lungs in different quantity. So मेक metoprolol with food. टेक metoprolol आपने किसके साथ लेनी है? फूड के साथ लेनी है. लो प्रेशर. ओके, ये दिस इज नीड टू बी मेंबर. स्विचिंग टेट्रेट एंड सक्सिनेट मस्ट यूज सेम TD. सो अगर आप क्या नाम है, metoprolol सक्सिनेट से टार्ट्रेट पे जो है वो यूज स्विच कर रहे हैं, सो यू हैव टू मेंटेन TD. So it is about total daily dose. Okay, now let's move on. Beta 1 selective nitric oxide vasodilation. This is available nebuvolol, pistolic के नाम से available है. Nausea, diarrhea, triglyceride, HLD, high density क्या कहते हैं, कोलेस्ट्रॉल इंक्रीज हो जाएगा. अब सेम टैक्यकार्डिया हो सकता है, अब्रप्टली नहीं करनी, टैपेट करनी है. सीवियर लिवर इम्पेयरमेंट है चाइल्ड. इसके अलावा जो है वो क्या हो गया, लिवर के पेशेंट में बहुत ज़्यादा मतलब प्रिकॉशन के साथ यूज़ करनी है या नहीं करनी. ओके, नेडोलॉल. इसके अलावा हमारे पास आती है नॉन सेलेक्टिव बीटा ब्लॉकर, TPPN. इसका निमोनिक क्या है? TPPN. सो द ड्रग्स आर नेडोलॉल, पिनाडोलॉल, propanolol, timolol. So these are the known selective. They can bind to beta 1 and beta 2 both. So nedolol is Cugard, pinadolol, propanolol, Indrall, timolol, Timopik. Heart rate decrease, hypertension, fatigue, dizziness, depression, libido, impotence. May cause hyperglycemia in type 2 diabetes by decreasing their insulin. Propranolol has high lipid solubility, so it crosses blood-brain barrier, cause more CNS effects. Useful for migraine and prophylaxis. अगर आपको माइग्रेन हो रहा है तो ये इसके लिए बहुत ज़्यादा यूजफुल है, तो माइग्रेन में प्रोपेनोल जो है वो दी जाती है. दिस वेरी इंपॉर्टेंट पॉइंट. नॉन सेलेक्टिव बीटा ब्लॉकर प्लस अल्फा 1 ब्लॉकर. नॉन सेलेक्टिव बीटा ब्लॉकर कार्वेडोलॉल, स्कोरेक, लेप्टोलॉल. So we are studying about non-selective beta blockers, which is decrease hypertension हो गया, may cause हो गया, okay, usual migraine prophylaxis. Let's move on. Non-selective beta blocker and alpha 1 blocker. These block beta 1 or beta blocker and also alpha 1 blocker. So this is carvedilol, labetalol. Labetalol when you are using labetalol for pregnancy. Edema, weight gain, triglyceride, liver impairment, take with food. Correct 2, correct CR 3 multiply by 3 इफेक्ट आएंगे. ओके, सो आप जो है डोज को क्या करेंगे, 3 मतलब मल्टीप्लाई करेंगे. ओके, एलिस्क्रिन is available with the Tectorna direct renin inhibitor. It's directly inhibit block angiotensin to angiotensin 1. Angioedema, hyperkalemia, hypertension, renal impairment, these are adverse effects in pregnancy. You are not taking it. CYP3A4 precaution, avoid grapefruits आपने नहीं लेना. Decrease level of furosemide यानी Lasix. Do not use with ACE inhibitor or herbs in diabetes के पेशेंट में ACE और herbs के साथ यूज़ नहीं करना है. Avoid high fat food को अवॉइड करना है as it increase your fat level storage.